Hello and welcome to the Discover History YouTube channel, and today we've had a request from Miss Withers and it's regarding a medieval surgery. Now if you have a look at some of the earlier videos that we've shot, one, I think it was last week, looked at medieval and medical practitioners, which basically gave an overview of where people could get help. So is it their parents, the church, the dreaded wise woman? But what we're concentrating on today is the surgeon. Now by the 15th century, the surgeon had to be a member of what was called the Barbers' Surgeons Guild, which basically meant that he'd had full training and was a pretty experienced individual, really. The sad thing is, because of the church and the power of the church at the time, no one could actually dissect a human body. So usually when a surgeon had been taught the trade and he was an apprentice, so he was sewing people up, for example, for the lead surgeon, the first time he ever operated on someone was probably the first time he had actually seen inside a body, because it was illegal. The Christian church means you cannot dissect or alter the body in any way, shape or form. So interestingly, we know these surgeons as skilled people, but if you compare them with a modern surgeon, they're not that skilled at all, really. But it's the next best thing, an age before famously the NHS and great learning that comes along a little bit later. Now we could just talk about barber surgeons and cover the whole spectrum. The only problem is that is a huge topic. So what we're going to do over the next few days is break it down, and what I want to talk about today specifically is battlefield wounds, because obviously a surgeon would treat people in a town or city anyway, so he would be trying to mend broken arms, trying to mend broken legs, giving people haircuts, shaving a person, for example. But when there is a war, and what you have to remember about the medieval era is there was a lot of wars, then the surgeons had to work very, very fast at dealing with battlefield wounds. And battlefield wounds are absolutely horrific. You can have swords slicing down into the bone. In some cases you can have a semi-amputation of an arm or a leg from an axe or from a sword. You can have some horrific wounds from arrows, for example. It is quite a horrible thought, really. So we're going to take a look specifically at arrow wounds, because arrow wounds are pretty interesting things. I will also draw your attention that Henry V actually got hit in the face by an arrow, believe it or not, in the Battle of Shrewsbury, and the arrow had to be left in for a while whilst people made the tools for the job and thought how they could deal with it without killing the king. So arrows feature a lot in medieval warfare. As I like to call them, they are the weapons of mass destruction. These things are being loosed, shot through the air from about 300, maybe even 400 meters away, and one archer can put 11 arrows in the air in 1 minute. So they really are weapons of mass destruction. Now if you're hit with an arrow, it's likely to go in quite a long way. This is not a real length of an arrow. Arrows are pretty long things, but when a surgeon sees someone with an arrow wound, it's probably about that long. That's as much as they can usually see. You may even see from the other side where the arrow's gone through. Now there's different ways of dealing with this, and throughout the Middle Ages, from 1066 all the way through to the Wars of the Roses in 1485, 1486, arrows were dealt with in different ways. So I'm going to generalise. Now for some surgeons, the easiest option would be to snap the arrow off and then push the arrow all the way through. Now the reason for that is because arrows come with different types of point. So if you can't see physically what the arrow type is, if you start fiddling around and pulling it out the way it came in, you could cause further damage. So in some cases it is easier to snap it off and push it all the way through. The problem with that is you have an injury, one arrow wound, and by the time they leave you, they're leaving you with 2 arrow wounds basically. But if you see a surgeon, and there is an arrow in someone, the worst thing you can do is leave it in like that. And the reason is, every time the person moves, and you have to remember there's no anaesthetic, every time the person screams and tries to escape from the clutches of the surgeon, this is likely to poke the surgeon in the eye. So the easiest thing to do is snap it off. Even if you're not pushing it all the way through, the easiest thing to do is snap it off. And then once you've done that, the surgeon would use his bare hands. There's no surgical gloves or anything like that. And he doesn't need to use a tool, because you've got so many nerve endings in your finger that will tell you what type of arrow it is. It's much better than trying to use, for example, a probe, which they used later in history when people are shot with bullets, for example. So the surgeon then puts his fingers into the arrow wound, which sounds absolutely disgusting, causing great pain, obviously, to the casualty. But he's searching to try and find what type of arrow it is. Now, we're looking at two types of arrow, but there are quite a few different ones. We have the barbed arrowhead, so this has two nasty points on it and two very long cutting edges. The problem with this is it's likely to get stuck. It's barbed after all. These were usually used not just against people but against mounted troops, cavalry. And then you also have the bodkin, which is nothing more than a little spike. And these are the easiest ones to deal with. Now, if we're going to feel around in the wound and find there are no barbs on it, for example, we know it's now just a bodkin. That should be pretty easy to move. So if you grab hold of the wood, it should be able to be manipulated. You should be able to wiggle it around and it should slide out easy enough. However, sometimes these can get stuck into a joint, which sounds absolutely horrific. In other words, it can get lodged in a socket or maybe even lodged in a bone. In which case, the surgeon may take one of these. Now, all the tools that I'm showing you, they were usually very different. Every surgeon's set, there was no standardisation, so my set may be different to another surgeon up the road. And like I said, with Henry V, they had blacksmiths making tools for a specific job. So you can imagine the surgeon's equipment would grow over the years. The more problems he finds, the more blacksmiths he gets to make new tools, the more tools he's acquiring. So this is an arrow extractor. And at this end you have what I always think looks a bit like a corkscrew or a worm on a cannon for scraping out the debris. And what this was used for is to push into the wound, so it goes straight into the wound, and what you're trying to locate is the wood of the arrow. So you've got the arrowhead that's made out of iron, but where you've snapped it off you have the wood, and the idea is inside the body you're trying to link up that iron screw with the woodwork. And then what you have to do is push into the joint or the bone that the arrow's stuck in, and you turn it and you turn it and turn it, and what you're doing is slowly, like a cork, is you're grabbing hold of the wood, and therefore when you withdraw it, the arrow should come out attached to the bottom of it. Pull it off, and that can technically be thrown into a fire, burn the wood out, it can go back to the archers and they can attach it to a new shaft and shoot it again, basically. So that's a way of dealing with a bodkin that's really badly stuck into the joint. Generally speaking, you try and pull it out. Further back in history, as I mentioned, they often used to just push the arrow all the way through. We do also have here some forceps, which have been around in history for a very long time. That can also be used to grab hold of the ironwork and then slide it out. But like I said, the fingers have usually got more, has more nerve endings, and therefore you can actually tell what you're doing even though you can't see because of the blood. Now, the arrow that's barbed is always going to be a problem. We know the Romans had problems with these. We know everyone in history has had problems with barbed arrows. They're very difficult to get out. You usually do more damage extracting them. So, in this case, if I was a surgeon, I've noticed there are two spikes inside the wound. I now know it's barbed. Well, there's two ways that you can deal with this. You can try and locate the edges and manipulate it around the flesh and whatever else is in the way. Or the easiest thing to do is take some goose quills like this. So this would be prepared in advance. And what you use these for is you reach into the wound, find a spike, and then place the quill over the spike. And you do that with the other one also. So the wound will now look like that. You've marked where the barb is. Now this is the clever thing. That's why I wanted to talk about arrow wounds today, because I find that more interesting than the other things that surgeons do, like removing a finger or cutting an arm or a leg off. So we've marked the barb, and remember it's the barb that's the troublesome bit, the two spikes. And the best thing you can use now is what is sometimes referred to as an arrow spoon, and that's probably because these started life as two spoons. And what you have to do is you follow the quills down until you reach the ironwork, and what you have to do is constantly squeeze that arrow spoon together, and then when you get to the bottom you're actually covering the barbs with those two spooned edges. You grab hold of it nice and tight and you pull, and because you've guarded those barbs with the spoons, it will slide out pretty easily. It's quite a clever device. There are other forms of extractors for arrows as well, and some are really complicated, involving screws and all sorts. But that is a little bit of an overview of how you remove an arrow from someone. Like I said, arrows were common. Before the invention of guns, arrows were the main long-distance killing machine, the weapon of mass destruction. Now, the problem is you've got a patient now in a lot of pain, and the arrow that was stopping the bleeding is now out. So you are going to have a lot more bleeding and a lot more pain. Now, in medieval terms, there's no easy way of dealing with a bleed. We haven't got the same facilities as, for example, the NHS has today. So a medieval person, a medieval surgeon, would take something like this, which is known as a cauterizing iron, and this would sit in a brazier during the operation. So this would be getting hotter and hotter and hotter, the equivalent of an iron that you would iron your clothes with. This would be red hot, and unfortunately you have to inflict more pain on the casualty, because this now has to go into the arrow wound to singe and close the arteries that are bleeding absolutely everywhere. It would be an horrific experience for the casualty, and probably not that exciting for the surgeon that's doing it either. And that would stop bleeding, because the interesting thing is when you touch arteries with something hot, it causes them to contract, close up, and the bleeding will stop. And it's a technique that's been used for years. To a certain degree, cauterization still takes place today. A friend of mine had their nose cauterized because they had a nosebleed once, for example. So cauterizing still takes place. Then all you need to do is take a needle and thread. They weren't too bothered about having small needles years ago. Sometimes they used a block of beeswax to waterproof the linen thread, and then you would stitch the opening up and then place a dressing on it. These were usually made out of linen packed with moss. That would go over the wound, and then covering it with some cloth as a bandage, and hopefully that person's life will be saved, and the person will be able to, in theory, go back to their job at farming or going back into battle. Now, the sad thing about it is infection. The surgeons will be using these tools from one person to another. I haven't washed my hands, and there's bits of clothing in the wound, horrible dirty clothing. So as you can imagine, they may survive, but a lot of people would have died of the later infection. Anyway, hopefully this has been a nice little introduction to how to remove an arrow for your surgery. Tune in again and we'll cover another aspect of medieval surgery for you. Stay safe and see you soon.